Okay, how are we going, everyone? So, what I'm going to today is talk about stress and the importance of it, something we all relate to, and diving into particular areas which I know are very beneficial for someone to wrap their head around stress, as we tend to get thrown all different types of stresses in our lives and in different parts and periods of our lives. But then as well, just trying to understand that life is also about stress and how we manage it and how we need it as well, and the importance of why it's necessary. That's also this important understanding around how we actually manage it ourselves and how it relates to our own personal lives, because person A will have different relationship to stress to person B, and different things that will stress them out from person to person. So yeah, trying to understand this idea around stress and this concept that affects us all in some shape or form. But also, it's not just us that gets affected by it. It's a part of biology and a part of life, even. As we see down here, we have all the different aspects of stress that also can contribute to animals and plants and ecology and ecosystems, from the different types of threats that we have associated, from our climate threats to our soil threats, from stuff like bacteria, viruses, fungi, insects, but then also our pesticides, herbicides, microplastics, heavy metals. All these things end up in our agriculture, or can be, end up in the systems of the food industry and the different sort of ecosystems that make up our biology. And also this understanding of the poor nutrients as well, our diversity, our micro biodiversity, and then our climate threats, from this idea obviously of climate change and this belief that these aspects of natural disasters, so floods, extreme temperature, drought, UV, wind, and more those extreme climate threats, they're contributing to potentially some stress onto our ecosystem. And from these aspects of obviously how things grow, the water uptake, the soil nutrients, the supply of nutrients as well, photosynthesis and the like. So this connection between a stressor in whatever shape and form it is, obviously a bigger stress is when we get into this aspect of ecosystem, but then also how this connection has to humans and health and well-being. And like I said there, it is a part of biology and it is a part of life, if it is something that we are nature after all, and this aspect of the world we live in as well. So it's not just us. When we think about this, we are going to dive into more the health aspects and the health and fitness aspects, but realizing that it is also just part of life, as life is about stress. But what we want to understand is also some terms and definitions, as a lot of people sometimes may not be actually able to describe what stress actually is in a nutshell. And that was something I've struggled with for years. When I first was learning, going through my university and my coaching and trying to relate to people and talking to clients about what actually is stress. And it was something I had a rough sort of ballpark idea of, but never actually could really define it in a true bullet point, dot point. And basically what I've just done here is describe what I feel stress best is represented and best defined as any non-specific response of the body to any demand for change. Non-specific meaning general, meaning that there's so many different layers and different aspects of a response that our body has to then deal with in some way. And there are things that are really specific when we dive into more of the subsections of stress, as we'll go into. But as the picture shows here, we have all the things that make up sometimes even just someone's whole day, and from when they wake up to when they go to bed, in terms of stress, but then all the things that causes someone stress, from maybe sleeping in with their alarm, maybe being late to get to their work, from their schedule just being so hectic and busy and stressful, and their time management of how everything just gets condensed and everything gets all done in, sort of one sort of block, and then the actual ability to sort of spread out the workload, for example, and then people rush in to get places, to be places, busy just from doing things all the time. This is something that I feel like we can all relate to in some way, in shape and form. This is what I've just done there, is describe some people's work lives and their 9-to-5 job, for example. But this can be in all different ways, of course, from someone who's trying to do something completely different in their day-to-day, but then also that maybe they've got the schedule it fits into, and from the health and fitness point of view, maybe their schedule in terms of training and how they then apply the stress, and also demand for the change they're looking for, the response they get. But then as well, it can be all different types of schedules. People who are parents, for example, and something I've definitely understood over the past couple of years is that, there's a stress that comes on, and you have to manage how you manage your time, and how you obviously get busy with just so many things going on, and then having to also fit into your own schedule as well. So there are a few depending on the area of focus, but stress in a definition form, in my sort of definition form, any non-specific response of the body to any demand for change. But we know there's different subsections to stress. And the first one is usually the medical side, which we think of. Any type of change that causes physical, emotional, or psychological strain or pressure in the body. And that is a big one when we talk about in the body, because we know that there's the types of demands that we would place onto our body, but especially from the health and medical side, in terms of maybe going through a health-related issue or a chronic health-related issue, but even from like a surgery, for example, or trauma, that's a huge amount of strain and pressure, both psychological and emotional, as well as, of course, physical. But then even like some of our medications can put stress onto our body, and in different types of drugs. And this can be, again, this minimum effective dose idea, which we'll discuss in the future slides. But we know there's obviously a difference from just these simple basic medications that just help manage pain, for example, to more of those extreme and more of those pain relieving, but then these different types of drugs and medication, which will be causing a lot more strain and pressure, but then our body gets accustomed and used to it because we're used to that response in the body, and then the change we're looking for may not be there. So there's something that's obviously more powerful and stronger is sometimes needed. Psychological stress is a huge one this day and age, and it has been for years, and the state of mental, emotional strain or tension resulting from adverse or demanding circumstances. People are very resilient, people are very robust and can overcome all sorts of things that come their way, and different adversity, different setbacks, but it does take a toll. And there is that point where for some people it does have that strain and does have that potential burnout or some things which can cause this feeling of psychological stress in a state of mental, emotional tension as well. And this can be, again, from all different factors and circumstances and demands that our body will have to respond to. From, just as simple and basic things to really extreme, almost, really psychological things, and really demanding things, and really emotional, traumatic things that we have to then potentially respond to. And this psychological strain is a huge one that we know affects so many people in different shapes and forms. Physical stress is usually a pretty common one, and we think about this usually in the gym, but anything in a physical sense, object, for example, and its definition here is an internal force divided by the cross-sectional area of the surface on which the internal force is acting onto. So a bit of physics there and a little biomechanics if it is in the human body, of course. When we think about tension, compression, and shear forces, those are the three big ones that affect our body when we're trying to apply load, for example, or an internal force that's coming externally from like a barbell, for example, or playing sport, for example. Compressive force being like if we had a barbell on our back doing back squats, that compressive force is going down into our spine, which can help actually to make some of the structural ligaments and the structure a little bit stronger, if it's our bone in our intervertebral discs or natural sort of intervertebral in our spine, in our structures there. But it also even like some shear forces which can happen, for example, in a negative form, if it's an ACL, something that comes laterally to our knee, for example, in a shearing force can have a huge effect on whatever angle it is, have a huge, obviously, effect and a physical stress onto that joint, potentially rupturing something and affecting that in some way. The psycho-spiritual stress is also another huge one, which ties in a little bit to our psychological stress at start, where crisis values meaning and purpose. And this is something that for so many people, sometimes this idea of self can be really affected and really affected by some sort of stress, but actually having that stress of who am I, what's my identity, and also what my values are. How do I sort of stick to what I know is best for myself, and also my priorities, and also what's the meaning and the purpose of what I'm doing. And is there anything that does go into that idea of what's the purpose I'm doing this for? And also this idea of what am I valuing as I do this? And when people value something, that holds a lot more meaning to them. But if someone is having a bit of psycho-spiritual stress going on, that really does contribute a lot to this idea of questioning yourself, questioning what's the purpose? What's my purpose? What am I trying to do this for? And this gets into a whole different area of the clinical and to the emotional and sort of this counselling idea or whatever support networks there'll be. So really worth understanding that it is a stress as well, and something that body and all these, in whatever shape and form, the body will have to deal with and respond to for that demand for change. A few other common terms as well. We had our definitions, so a bit more common in terms of this terminology. The acute stress, which is stress that only lasts for a short period of time as an immediate reaction to a perceived threat, challenge, or scare. And this is something that is a big thing, because acute stress is not bad. We think sometimes stress in all its defined, how it's defined and how imagery, it's always bad. The stress is actually needed. We do need stress if it's in that short period of time, whatever, again, shape and form of stress comes in. It's usually though when it sort of compounds and results in the chronic stress, which is where we get those negative health effects, especially. Chronic stress resulting from repeat exposure to situations that lead to release of stress hormones. This type of stress can cause wear and tear on your mind and your body. And this wear and tear, or this allosteric load, is a huge thing which we're going to dive into in our future slides. But chronic stress, that's where usually the real problems can sometimes lie, and the real issues start to pop up for someone when it's repeated and when it's exposed for long periods of time, not just in a short time, in a few minutes or a few hours. It's when it's over and over and over for weeks and weeks and weeks, days, months and months, for some people years and years, and the effect that has on our body and our mind as well, that ability to sort of have that wear and tear, or feeling that strain, or feeling just this burnout idea and this burnout symptom and this feeling of burnout or feeling of exhaustion. We do have this chronic stress going on. If it's something training related though, this is really important, because acute stress is great. That's our training, that's our stimulus, that's we add stress to our body in order to see that demand for change. And usually that is always this case around trying to add stress, but also maybe trying to buffer stress, trying to manage stress with all the other stresses that we have compounding and going on, and trying to ensure that's also managed to make sure it's not going into that chronic stress, as I'll dive into. Sometimes even exercise itself can be negative stress if how it's done. Internal stress comes from inside of us and determines our body's ability to respond to and deal with the external stress inducing factors going on or the stresses coming our way. This is the most common type as it's experienced by us all. And this internal stress that we feel is obviously how we feel, but it's different for everyone. We have this ability to be resilient and this ability to, people can tolerate a lot of stress. That's different person to person. So really important to consider our body's ability is always different. Someone's ability to deal with stress is different from someone else's ability to deal with stress. And also what they've got going on in their environment, what's going on externally coming their way. Really important, because the external stress are the ones that come from the world around you. They include things like minor or major life events, work, the weather. Yes, even the weather can be a stress on our body, from hot and cold, but also what's happening from the extreme weather events potentially. The level of noise coming our way is something that is starting to get a lot more traction from people trying to be still or trying to escape the noise or unplug in some way because of all this stress they've got going on. Also, that's a mental thing because of all this sort of noise they have going on in their mind and this busy mind and busy life as a result. Air pollution, which ties into a little bit of the weather, but also the external stresses and something which, again, for some of these things is out of our control, especially pathogens or what's going on in the air, especially as we just touched, and things we can't control. I've got the old C word up there, the stuff that shut down the whole world back in 2020. That's definitely was a very, very stressful time for a lot of people, from their businesses, from their life, from their family, from their health, from their relationships, to everything going on once. And again, that stress of having everything going on once. Our physical environment, the people around us can also cause us stress, as you can imagine, from different environments, from work to family to friends to whatever the case can be. And then our relationships with them as well can also potentially be causing our body to have that little bit of stress. Some of this we can control, but there's a lot there, and a lot here that we can't control, as you can imagine. To some degree, there's always that factor of we can still have a bit of control, but there's a lot of things that make it a lot more challenging, as we can imagine. Direct stress, more than the body feels or experiences, and the forces acting on it. I've got the example there, thinking about tension in the muscle. We have that direct stress, we have that feeling of our body going through that contraction and that feeling of that stress from either a weight causing that tension to happen in the muscle, or an indirect stress, very similar to those external stresses on the body, but more centered on this physics and engineering and this factor in this industry and that area of focus. The stress response is this any physical or psychological stimuli that can disrupt homeostasis, which causes a stress response. Homeostasis is this idea around having everything as even as it can. When we bring a stress or a stimulus into that, it's going to disrupt it in some way, big or small. Again, it depends how much the magnitude is and how big, and the constant exposure to this potentially, which then can also affect someone's homeostasis and how someone adapts over time. And that needle can move one way or the other, positively or negatively. The most common stress hormone that people will think of is cortisol. Steroid hormone is produced by the adrenal glands that sits on top of each kidney, involved in metabolism and the immune response. It also has a very important role in helping the body respond to stress. Again, too much stress, negative when we have that chronic, but the right amount and doing it in acute stage, very beneficial. And as well, this relationship with stress to the immune system and the immune response is also something we'll dive into. It's something that this time of year of winter really matters. Now we have that bit of background. Let's try and dig a little deeper to understand and trying to build some context around this. Because as I've said here, stress is not always a bad thing. Do people ever put themselves in a stressful situation by choice? Or is it something people avoid at all costs? and I'll just spend a few seconds just for someone to digest that idea, and I'll repeat it again. Do you ever put yourself into stressful situations by choice? Or is it something you avoid at all costs? And that's an idea around maybe this mindset, this growth mindset versus fixed mindset, taking on a challenge or avoiding it at all costs, getting out of the comfort zone or staying in it at all costs. Something that we all would have decisions and choices to go throughout whatever the day brings and whatever our situation presents itself with. The body needs stress and strain, especially when it comes to achieving the most common goals in the gym and training. Without an appropriate amount, don't be expecting too much change in your body wise, unless it's over a long, long time. As someone who's trained for years and years and years, they can tick over doing the minimum effective dose, applying that just amount, that stress. It's almost like the old Goldilocks idea, not too much, but not too little, as we'll discuss. But as long as it's also consistent to constantly have that little bit of exposure and that stimulus. And that's the tricky part, if it's consistent, because even the opposite, someone can do the most stressful workout in the world, they can smash themselves in the gym, crush it for an hour and a half, but unless they're not backing up that with recovery and then getting into their next workout, is that going to be in the next few days, or potentially if someone's done so much that they can't recover and then they're having to train a week after that workout because they went too hard, too early, too soon, too much, and then they actually can't respond with that right level of recovery to be able to then see changes that we want. So applying that stress recovery is always a massive thing, which we'll discuss. But I always say, so why not go bang for buck to get to the goals faster? Someone could do their goal in a shorter period of time if they stick with it in 6 months, or someone can do it over 6 years. It's up to them, as long as they're applying the right amount of stress and actually train hard enough to see the changes that they want, because stress is the driver of adaptation. Adaptation is that the desired change, if it's strength, muscle, gain fitness, or body composition or physique changes and goals. Stress is that driver to seeing that adaptation, and the adaptation is a response in our body, how it looks, how it performs, how it feels, how strong it is, what we feel like and look like in the mirror. This is especially in the physical sense, but also all the other desired changes people will want to gain: an increase in energy production, better health in all forms, how they perform, if it's in their sport, for example, and so on. How easy is as well to think about if someone's applying a right amount of stress, if they're stronger, fitter, faster, in better physical shape. Do you reckon they'll have more energy to do whatever they want to do in their day or their lifestyle? Most likely they would, because they can always draw on that ability to have that. They've had that stress, they've had their response, their body's adapted, which usually means as well that they're going to have more energy then and more resources then to put out to what they want to do. So stress is not always a bad thing. It's always about how much and how it's applied. And this is where it dives into the supercompensation theory, or the stress recovery window and the stress recovery adaptation cycle. And showing this level of recovery is also one of the key, or one of the sides of the coin as well. Our biological state before stimulus is the black solid line that's in the middle here. And usually that's how our body's adapted. And this is that idea roughly of this homeostasis. So this biological state that we're in, how our body's adapted over time to the stresses. But then we introduce a bit of fatigue into our system, or a bit of stress in form of training, for example. And then from there, how well we recover will then determine how our supercompensation is, or the gains and the results we get from the exposure to stress, or the demands and the adaptations that we've and the changes we've gained because of the stress we've applied. But this is diving back into that Goldilocks area of not too much, not too little, and that just right or that adequate or that sweet spot. That's what the red solid line is on this slide. Training is adequate, so it's enough, where it's not too much but not too little. And as well, we've recovered appropriately on time, or we've able to recover. People think obviously recovery, and these days the trends are all towards the ice baths, the saunas, the compression boots, the meditation, the yoga, whatever that is. That's still about the probably 20% of recovery. So it's the top of the pyramid. The base of the pyramid and where recovery mostly is this thing that we all know when we think about health. Food, sleep, hydration. That is your bread and butter. Food, bread and butter, recovery. All the ice baths, all the compression boots, all the saunas, all the different types of recovery methods, from your foam rolling to your massage guns to your meditation to all these things, will only go so far unless someone's eating appropriately, sleeping appropriately, hydrating appropriately for their training goals, and how well and how hard they're applying that training load as well, and how it's managed in a schedule, or hopefully, if someone wants to get the most out of it, a training program and a schedule that fits and applies those principles with this supercompensation, but also the progressive overload as well. When we do things too hard in the red dotted line, we end up having to have a huge amount that our body has to respond to from that training fatigue and stress. And it's going to often take longer unless someone's very, very, very conditioned and knows their body well to be able to recover, and understanding if they're obviously a professional athlete or something, they can usually train a lot harder, but because they recover harder, that means that they get to where they're trying to do for their goals a lot quicker. And also, training too hard can be sometimes that motivation where someone can't back it up over time. So they end up, when we get to this new stimulus applied area, they can't actually back it up because it takes longer to then get up to do a nice session like that, or nice sessions like that, if they're trained towards something particular, event or a sport or sporting event. So they end up actually potentially back where they started because they've trained hard, they've done everything, they've smashed it out of the park, they've gone hell for leather, but they actually having to recover a lot longer and then having to repeat that workout again. But if you follow this trend, what can happen sometimes is that can go and dip and dip and dip. Potentially people will lose motivation because that is a lot that have to sort of back up from session after session, and the mindset of it all. They can end up being run down as well. They can end up getting injured, or niggles could start to pop up, or things could start to happen in their joints. And then where they end up sometimes, even if they're still training hard, are they actually getting them right? Or they're actually training smarter, not harder, actually seeing the changes and getting towards the goals. The black dotted line is where some people I find don't do enough. They're not applying the right and the appropriate level of stress that they need to see the changes that they want. If someone's trying to gain strength or gain muscle, yes, they actually do have to lift pretty heavy weights to overload their body and their muscles to see the changes in the supercompensation they need in order to hit the goals that they want, because otherwise your body will just end up adapting to what it's been. This is only, again, if it's done long-term and consistent for years and years and years. Then if someone's trained too easy, they're just hitting that minimum effective dose, they can still see gains, but it's going to take a lot longer than they envision and their expectations are. That causes people to end up just throwing the towel, end up just doing something else completely because they're not seeing what they wanted. But are they actually trained hard enough is often the question. Actually applying the right amount of stress, or are they doing the exact same thing over and over and over again? Are they actually doing anything different? Are they applying a different stimulus to their muscles, a different way of training their biceps or their glutes or their quads? Are they doing a different program, a different exercises, a different way of doing your bench press? Doesn't always have to be with a barbell. Different stimulus actually is a good thing, because then it's a new stimulus for our muscles to then adapt to. And if not, we're training too easy because it's also something we're familiar with and we're in that comfort zone if it's something we've done for a long, long period of time. But then where do we end up if we're doing the exact same thing and we'll repeat and repeat without actually changing anything about it? And this can also, if someone's doing that and they can end up a bit sort of mundane and going through motions, how motivating is that to then continue to go? It could be part of someone's routine, of course, but there's an actual meaning and purpose with their training. And sometimes then they will end up just doing a session, but it's going to take, they only get a small smidge of benefit out of that session. It's also how consistent that's done as well, which is what the ABC is about. If someone does a train session back after doing their first train session with our slide here, and they apply a new stimulus or a new workout, for example, new fatigue, but they've only trained too easy, they end up back where they started, but they're only sort of just nudging a little bit of gain. If someone does that, but they've trained way too hard, they haven't recovered as well, that's to back it up again. How well will that next training session be if they're already sore, if they're already fatigued, if they've got their legs are all heavy and everything? How well will that session be potentially? So if we want to try and get the most out of our training, try and follow the red soil line as much as you can, and try to make sure you're also recovering as well as you can and getting that next workout in on time. But sometimes less is more. Doesn't have to be 1 day a week, doesn't have to be 5 days a week. It's what else someone can really hone in on with their schedule. Stress and health. The impact of stress, especially chronic, on health is massive. Life stresses, including life change events, major life crises and trauma, and chronic stresses. These are the things that we associate with that psychological stress reaction. That can also involve a bit of depression, anxiety, or mental health issues. The stressor response also can be characterized by biological response. It's associated with the onset or can exacerbate a wide spectrum of physical illnesses. And this can be this case that so many health issues, so many chronic health issues, and so many illnesses and diseases can have a stress component, and most likely will, because the odds would say and the statistics would say that most likely will. This is not just you it impacts. People around you can also be impacted by this. We know how many people can act when under stress and have so many things going on at once, but that also can mean the people around you can also be affected and can have an impact in some shape or form. We know when someone's stressed out, potentially their body language, but also their communication to someone else, if they're under a state of stress, can sometimes not be the most healthiest, for example. As we have here, even too much exercises can be bad for the body, depending on the type and context. Bad, again, quotation marks. It's always what type of exercise and how much and the type. But as I have here, walking every day is good and easy to recover from. So you can do that every day, of course, that's exercise. Doing HIIT, unless someone's got a background of conditioning and their endurance and strength and their body's well tuned to it. But most of the time, vast majority of the time, may not be the case for most people out there. But doing something like HIIT every day, not so much, especially if they're not recovering from this, and especially with this allosteric load concept, which we'll dive into. If someone's sick often, prolonged stress leads to chronic elevated cortisol levels, which can result in reduced immune function. Someone who is sick often are going to be more susceptible to illnesses, diseases, and environmental pathogens coming their way, and viruses, bacteria, you name it. But also fatigue as well. If someone's fatigued and their body's in a state of fatigue, they're also more likely to get sick often because they're immune response may not be there because the energy and the resources, again, put into trying to get the metabolism going again to not be fatigued. Because the stressor response is, and the stress exposure is well known to impact immune system activity, how well your immune system fights off what's coming in. For if someone's under a state of stress, it's going to be affected definitely in one shape or another. This allosteric load idea is something that I picked up a few years ago, sort of at the back end of COVID, because we all had the time in the world to try and have an understanding of, and like you're trying to learn what was going on, but then also maybe do something different and just use your time for something else. This is this idea around all the different types of stresses we have going on, and this idea of this burden or this accumulation of the chronic stress and life events and everything going and happening all at once. From physical stress, emotional stress, work stress, relationship stress, mental stress, nutrition stress. Yes, food can also be a stressor on the body, but also people can stress out a whole lot, even just about food. Think about trying to go to the supermarket and trying to eat healthy. And also if you've got kids, and just that stress of just trying to understand food and food overall, but then the nutrition stress of actually what we're pulling into our bodies as well. And also sleep stress, as we can imagine, if we're not sleeping well, what that does to our body and what stress that puts in our body. But the body does a bad job in differentiating these multiple different stresses. It often just collects with one stress likely to affect another, and vice versa. One will be affecting the other, and then the links, and then you can see there'll be a lot of overlap on a lot of this stuff. Usually there's always one stressor that can also dominate some of the others, but those others aren't just ignored. They'll still be there, even if it's this one's taking up the burden and the big chunk of what's causing some of the stress. The allosteric load idea is this idea that we have all this accumulation that our body has to deal with and respond to, as we said at the start. And this is this idea around this wear, tear, and strain felt in the body and also the mind. Allostasis is this idea around the process of maintaining homeostasis through change, especially when we think about the behaviors that we associate with what we're doing when we change things all the time, but also what we're doing from the external changes and the external things just coming our way. This is slightly different to the more commonly known homeostasis because it's an ever-changing balance and adapting to an ever-changing external and internal environment. Whereas the homeostasis is trying to keep everything stable and keep everything level, usually just to maintain life and life functions and pH levels in the body to glucose levels to different aspects of oxygen tension and in the arteries and some of these other things, because it's constantly present. It's something that even our body temperature is usually constantly present to stay stable and to maintain life. And we know that if there's a change, even in a few degrees from that, it's going to be big issues and trying to get back into that. But the allostasis is also this idea because it's constantly changing. It's only this temporary process it's only temporary to get back into some form of homeostasis. But as soon as we're shifted away from the homeostasis, our body will then try and adapt to bring us back to that stability, into that stable level, even keel. But we know there's always going to be something externally also just coming our way. In the body, this can also be different changes and different things affecting some our heart rate, for example, our body core temperature as well, from that homeostasis idea, because we're trying to get back into that body core temperature, but we have to adapt to what the external environment's going on if we're in a hot environment or a cold environment. Also, this idea around the energy metabolism as well. and also the sleep-wake cycle and how many things will be affecting that in terms of our day, and from night shift to kids staying up all night, can't sleep, or from screens, even like having blue light blocking glasses because of the blue light stimulus here in our eyes and affecting our sleep-wake cycle and our circadian rhythms. So this is ever changing from individual to individual. From constantly occurring for some, always having to adapt and change, or someone would barely notice it and they would always just end up just be able to sort of adapt and just go with the flow of everything. This allostatic load idea is dubbed that wear and tear on the body, or the strain we experience in mind, spirit, and of course, body. We all know that we feel, well, when we feel worn down, especially mentally or physically, this can even affect how someone ages, especially when we think about their biological age and how their body adapts, again, based off the stresses going on. But if they're not looking after themselves, they're not staying fit and healthy and strong, maintaining muscle, for example, that biological age can pivot to not where we want it, and it can accelerate how old we feel because of all these things we have just accumulating and going on. As we have here, we can see some of those things from external and internal stresses, from work, from bills to emails externally, to relationships, again, pollution. Social media is a big one, and that idea around this stimulus or this stress that a lot of people end up even addicted to, as well as their phones and this dopamine just coming their way, and also negative news and everything like that. But also the internal stresses as well, from our poor sleep, poor diet, lack of exercise, but also, as we know, excessive exercise as well. Poor gut health is always going to be a big one, and the effect that has, if someone has poor gut health, can also have a mental health aspect as well. Someone who's got a mental health issue, you bet almost, well, it's really, really likely they will also have a poor gut health thing going on. And also their relationship to food will usually potentially go unhealthy, in my experience and conversations with people as well. So a bit more of an understanding of that allostatic load is super important, and to really grasp that will be a huge, huge game changer for someone. We'll get into this technical stuff, this more in-depth stuff, this sympathetic arousal and the hypothalamic pituitary adrenal cortisol axis, or the HPA, always easy to say that. We realize that not all stress is created equal. As we said at the start, acute stress responses are great, such as like when we're training or exercising, and the benefit that has on our body, of course, we have an increase in heart rate, we're having sort of faster breathing, and obviously we're slowing our digestion, we're potentially having some other benefits and increase in our blood pressure in a good way. The chronic stress response, though, is where these issues pop up, especially health-related, and especially when we have issues in that aspect, as this picture shows, if the stress continues and the repeated exposure to it. From that chronic fatigue idea, from that poor gut health, increases in inflammation, potentially feeling pain a lot more, and also this feeling of pain as well. Obviously weight gain, mood changes, lower immune function as well, and a whole lot of others there which can be affected again if this stress is constant and chronic. So how does stress fit into training? The supercompensation theory, as we saw before, so we know that if we have the right level of stress, that Goldilocks idea, it's not too little, if it's not too much, but it's just right, we get that benefit of training towards the goals and being able to effectively hit and getting the gains and the adaptations we want. But also it shows, and not only showing the role of recovery, but also if we have too much or too little training stress, as we said, and that recovery idea as well. Because, as we said, stress is that driver of adaptation. The body will adapt and gain depending on what we're doing to it. We get out what we put into our training. For example, if when training or trying to gain muscle size or the old tone, one of those factors is metabolic stress. Doing high reps, for short rest for the burns feeling if we're doing bicep curls, or if we're doing a whole lot of calf raises at once, a whole lot of push-ups at once, or girls doing stuff with their glutes. We know that obviously if we train hard enough and knowing that we earn that rest because we are going higher rep and contributing to that metabolic stress, we will get the benefit out of that. Again, we get out what we put in. But if we're not trained in one of those key pieces to our muscle gain equation, and we're not sort of going to that period of maybe training to failure, we may not be getting as much out of our sessions, of course, and we're not doing that every exercise, of course, but applying that in little doses here and there can be hugely important. The RPE scale is one such method to gauge intensity of an exercise session in training. RPE being rate of perceived exertion, our 1 to 10 scale. If something feels stressful, obviously, and a lot more intense on their body, it's going to be a lot more higher in exertion. But it's also, again, what's being done. If it's training, but also exercise, because you also think about any endurance and any cardio as being RPE related as well, because people, whole workouts can be cardio mixed in with weight, strength and conditioning, but also how this then can be responded to how we feel in terms of our subjective idea of how much stress we put into ourselves. A really important thing is the RPE scale, to be able to have an understanding of that. Brad Stolberg is a really cool author and got a lot out of his stuff over the years. And one of these things he talked about is the equation that always stuck with me was stress plus rest equals growth. Or growth is stress plus rest, as he got there with the tree example. So too much stress, not enough rest. Again, tying this into our stress recovery equation, this idea, and you get illness, injury, sickness, and burnout. This also can tie into our allosteric load idea as well. But too much rest and not enough stress, and you can get complacency, boredom, and stagnation. People can really plateau with where they're going, especially, again, training in the gym, but even just in their day-to-day life, they're just going through the motions, it's Groundhog Day all the time, and they're actually not putting themselves into maybe some stressful situations and not necessarily stuck in their comfort zone, not embracing a challenge, to actually then grow as people, as persons in their workplace or in their life or whatever roles and whatever hats they have to wear. The old Thanos, if anyone's a Avengers or a Marvel fan, he said once, perfectly balanced as all things should be. And, this little picture here, which was pretty cool, and I definitely sort of relayed this to the central nervous system to be able to have that balancing act between the sympathetic or the gas pedal or the pedal which we call the accelerator, we call it here in Australia, versus the parasympathetic or the brake pedal, and knowing when to push those pedals. It's not always going to be perfectly balanced though, even though this picture says it, obviously the stones, but we know we have to have times where we put the foot on the accelerator, and to be able to get that response in the body, that fight or flight, this idea around the stress response to be a threat to our body, but then as we know, all the benefits we get from the acute stress onto our system. But then knowing when to take that foot off the accelerator, to apply the brakes, that skill is one that I've found a lot more harder for people to be able to do. And that's something that almost these days is a lot more challenging, for example, to be able to actually know when to rest, to know when to stop, to know when to be relaxing, to know when to just stop and rest and actually sit down, digest your food, just everything on the go. It's always on the go. We're eating everything on the go in the car as we go to our next job, or we go to our next appointment, or we go to our next, whatever we're going to, our next location, to actually sit, rest and digest, to be able to be in parasympathetic, to be able to breathe into that potentially as well, and actually get in touch with your breathing, rather than everything just being so shallow with our breathing. One of those things we do find with breathing, for example, is if it's always up in the chest, for example, we have a lot of issues potentially with somebody who's got tightness and tension everywhere here, And one of those things is simply because they just can't put the foot on the brake, because they're always stuck in a sympathetic dominant state. They're always stuck with the foot on the accelerator, always stuck in this fight or flight. And how much money are they trying to spend, or how much money are they spending to try and fix this issue when they simply could just put their foot on the brake a little bit more, get into some breathing and whatever strategies they would then do for stress. It's always though some things actually people try and do when it comes to stress. People sometimes do things to try and de-stress. If it's obviously comfort food or alcohol or going on holidays or even going running, for example, whatever this is, even though those things are actually causing them stress at the same time. It's a very funny sort of dynamic, but to actually be able to put that foot on the brake pedal is a really powerful thing. A few of these screenshots, a few of these pictures I've gone over the years from Stop Chasing Pain, who's a really awesome resource out there. There's a lot of stuff on social media, which is great, and I've got a lot of information, a lot of knowledge, and a lot of different concepts. He dives into this lymphatic system idea and this idea around the system in our body, the lymphatic system, and the importance it has on different parts of our body. But then how it also ties into a nervous system, as we just discussed with how autonomic nervous system, or the stress, fight or flight, rest and digest modes, but then also just stress overall, of course. And according to, like some of these pictures, when we have as much as 9% of all visits to primary care physicians or doctors over in America are related in some shape or form to stress, because the vast majority of humanity lives in a chemistry or soup of stress. And that is definitely a big thing when we think about all this stimulus coming our way, and dopamine coming our way, and everything we just build as society. And also, someone's more sensitive to pain if there is repeated emotional stress. We always think of ourselves sometimes as not real as we are human, and we do have emotions, but we're not robots, and we just can't keep on going. We have pains and feelings, and we have things we have to think about when we have to think about our body, because we're a system of systems. We have to think about that. We're not just the physical, but we have the mental, emotional, and those things will then contribute, though, to someone potentially having physical pain or feeling physical pain, being more sensitive to physical pain, for example. Someone's low back pain, for example, can be an emotional stress, but also can be caused by emotional stress. The vagus nerve is one of these really important nerves when we think about this parasympathetic idea, or this rest and digest. It's called the wandering nerve. You know, we have two of them in our body. People just sort of group them together as the vagus nerve, but we have two, and they actually also go into different parts of our body. So they're not just in textbook form, everything is all symmetrical, because they leave our brain and actually they're a cranial nerve, interact with all these different aspects of their organs in our body and our systems. And what we realize, though, is that roughly around 75% of your parasympathetic nervous system is controlled by this vagus nerve. So 3/4 of what we were saying before with that brake pedal, or that rest and digest, that parasympathetic, this is what causes someone to be able to do this. So this is one of the most important areas in someone's body to be able to really grasp an idea around. But and as it says here, only 20% of the nerve fibers actually communicate from the brain to the body. So when we think about 100%, that means 80% isn't coming from the brain, it's going up to the brain from the body. The body's always sending signals from the vagus, from the rest of the body, via the vagus nerve to the brain, to say everything's good, everything's stable, going back in that homeostasis, everything's stable with some of these organs and some of these things. When we think about our gut, our liver, our heart, especially heart rate, and also the potential changes that it has to result if we are experiencing decreased or increased heart rate, or if it's exercise, for example. Our brain, of course, mouth, blood vessels, such an important area of the body. It even can help us make memories, for example. It even can help us breathe and speak. It's also one of the most common reasons for someone to faint if they feel overstimulated. And as well, let your gut talk to your brain, or again, that gut-brain connection, that gut-brain axis, which again is a really, really, really important area. Of course, we think about that connection between those two areas, from our mood, from our overall health and gut health, but also the connection between the brain and the gut. This is always, again, if it's all functioning well, though. But sometimes there might be a bit of dysfunction in whatever way, causing some issues. If the vagus nerve potentially has a bit of dysfunction in some way, again, it's always hard to know exactly how much dysfunction, because there could be other things contributing to this. It's not just to say everything is the fault of the faulty vagus nerve, but it's really worth understanding that this could be a key player in what's going on and what's happening for someone. Especially when we go into this area, which is this polyvagal chart, this polyvagal theory, which is this idea around, we talked about before, of our fight and flight, or our sympathetic and our parasympathetic, which is our rest and digest. But there's also another area of this, which is called the freeze, or the, as I call it, the red light. So these are red, yellow, and green, or it could be traffic lights, stop, caution, yellow, caution, whatever someone's terms are, and green mean go. Green is our ventral vagal. This is our social engagement. This is the area that we want to try and stay the most in if we can. This is our ability to stay settled, grounded, present in the moment. And even just doing that is a huge thing these days. There's a struggle for someone just to be simply in the moment of what they're doing, what the tasks they're doing, but not stuck in what's happened in the past, not getting anxious about what's happening in the future. Just simply just be able to be mindful of where they are. But also have that curiosity and being open. This is our safety net, this is our green zone. And then what happens in the body when we're in this green zone, we get an increase in our digestion, increase in our rest and recuperation, increase in our immune response as well, which is a really, really important thing, especially now we're in winter and someone's watching this. And so think about all the things that goes into our immune system when we have this time of year going on, and everything's sort of a little bit, people getting sick a lot of times and got stuff going on. Health and vitality, our ability as well to breathe is always going to be greater if we're in this green zone, and also ability to connect as well. Super important. We're not social animals, we're social beings, social engagement as well, to be able to be interacting and involved with other people. Human beings, obviously, after all, and being able to be interacting and bonding. The green zone can always be called that anti-fragile zone, as I will class it if someone's doing any coaching with me, and sometimes just having conversations, seeing what the stress they got going on in someone's life, but then also potentially grouping them into then what the best outcomes would be based off conversations. And if someone's in this green zone, it means they're anti-fragile, which means that they're able to recover. They've not got so much life stresses going on, or they manage it well because they can tolerate it good. And as well, they're able to potentially hit the ground running and go, because they can know themselves well, and they're able to get back into this green zone, be able to be connected and grounded of who they are, but then able to have the help as this foundation, this backbone that they can go off as well. This sympathetic, or this yellow zone, is usually where we have this acute area. It's sort of this in between, this sort of caution area, if it's a traffic light system, for example, because again, like we talked about our sympathetic or our fight and flight area, this is where we can have this acute stress, which is great, to be able to get into this acute stage, into this fight or flight. All of the responses in our body result from increasing in blood pressure, heart rate, fuel more available in terms of fuel from our body, and stored fuel, eaten energy or stored energy from stuff like our body fat tissue, for example, or our muscles, for example. Also, our ability to increase our adrenaline and all these other aspects. We also get a decrease, though, in our ability to store fuel. We eat, for example, eating being sort of fuel, it's less harder for us to store that fuel as body fat, for example, but also as muscles in terms of glycogen. So really important to understand that correlation as well. Our digestion, though, as a result, does decrease. The last one is always a big one because your immune response decreases if you're in this yellow zone or if you're in this sympathetic nervous system state, especially, again, if it's chronic stress or if it's you stay in that part for a long time, repeated and chronic, and unable to get back into this green zone or unable to get back into this parasympathetic nervous system. So again, all these things around the emotional side, from whatever's causing these, from rage, anger, irritation, frustration, obviously that fighting and that ability to sort of get into that state of wanting to fight or having that come about someone with their nervous system. And again, their personality obviously would sometimes also dictate this. Or they could flight or potentially run away from something, have panic, fear, anxiety, worry, and concern as well. So this idea around this yellow and this nervous system being in this yellow zone, again, great for small snippets and great acute wise. But if someone was, for example, stuck, being frustrated 24/7, how well that would affect their body health wise. Or someone was always worrying all the time, how well that would affect their body wise and their health wise. So a really important thing about this, and especially this top one, we think about is a red zone or the threat, potentially life threat someone has going on, or this hyperarousal, which is parasympathetic nervous system, so similar to our green zone. They're both called the same. But this is when we have a lot more of our negative aspects or this unhealthy aspect, or potentially this idea around being immobilized or this state of freeze or this state of numbness, shame, shut down, helplessness, depressed, disassociated, to be able to be with someone but not be there with someone because they're disassociated wherever their mind is taking them, because they're not as present in the moment because of whatever is distracting them or whatever's causing them to be potentially in a state of depression or potentially in a state of trapped or helplessness, even potentially in this preparation for death because of whatever might be contributing to their health or in their mental health or their emotional health in this more unhealthy emotional sort of, this puzzle or this all this going on at once when someone has all these things contributing at once, or sort of bundle of stresses going on, or this bundle of mental, emotional, physical stress, or everything contributing to where they're unable to be back socially or engaged back in a green zone, or potentially they've gone way past the sympathetic and this fight or flight or this rage and anger, panic or anxiety or irritation or frustration, that they're in this, as I call it, this fragile state or this red light. And this is where a lot of red flags will definitely come up if it was someone with their body language or with their verbal language, their communication, with the words they use. If there was anything like this, that could potentially be linking things together to how they're verbally communicating, but they have this potential with their body language or how their behavior is as well. This will then increase, of course, our fuel storage, insulin activity, especially have this immobilization behavior. So obviously even potentially they won't feel any pain, or the pain threshold would increase. Again, if there's any medication going on, that could also be happening here. But they potentially will try and conserve all their metabolic responses because their body would be in survival mode. They'll be fragile, dissociated, so their body will do everything it can to conserve energy, conserve fuel, conserve and think about metabolism. All those things will also decrease from heart rate, blood pressure, temperature, muscle tone as well. Of course, social behavior, again, also immune response as well. This is something that if someone was presenting with some of this, from their behavior, from their body language, from their communication, I always would say that there's only so much that a coach or a trainer can do, because this is in a different scope. I always do some things with people from this idea around this red, yellow, or green, or this traffic light system. Being if it was red, they'll be more in this fragile state, where instead of working out, the answer is actually to work in a little bit more and to understand what's happening, or the stresses, but also if this potentially was going on. But if this was going on, I'd also say, I'm probably not the person for you, because, and maybe you're best to get real support and help, and someone more from the qualifications and the experience and the counselling point of view, because that's probably what you need best. If someone's in the yellow, on the middle ground, they're pretty robust, they're pretty resilient, but there's also potentially this back and forth where they, again, if they're stuck here chronically, can cause them some health issues. Even if they are robust and resilient and they can cope and tolerate a lot of stuff, but if they don't have a big stress tolerance bucket, potentially there can be a lot of things happening from a health point of view which should be impacted. And again, that bottom one, that green one, is that social engagement, but also that anti-fragile, as I call it, or that green, that go in the traffic light. That on itself, that bucket, or that idea around this polyvagal chart, could help someone massively in some way if they could grasp a little bit of that, if they feel that they're going through some of those things themselves, and to be able to help in that could be a massive step forward for them, in whatever step, in whatever direction it is for them as well. Stress relief, management and coping mechanisms. As we said before, of course, people have different ways that they would cope and manage with stress, and certain ways that they will cope and let the water out of their bucket in this allosteric load idea, as the picture shows. Of course, as we go back from a few slides to that, if we have gratitude, if we have good sleep, if we have a healthy diet, again, healthy, we still have to treat yourself, of course. Connection, healthy exercise, that right relationship with exercise. Nature is always something that I will preach until I'm blue in the face, or I'm definitely an old man, to be able to get into nature, to be able to be in nature, and to be able to do these things for nature is super huge and so beneficial, because when we think about medication and drugs, no medication and drug can replace what food, sleep, and nature can do. None, because we're humans after all, and you are nature. But we know those benefits of just those three things, which we have as much of our control in as we can, have the biggest impact on our health overall. Fun, relaxation, laughter, purpose, passions, having something that someone's passionate about, and also sunshine. Obviously, filming here in winter in Ballarat, not as much sunshine, but there's still the sun coming in. It's just not as pronounced as when it's in winter. There's still going to be able to get sunshine, UV, and obviously vitamin D and all those things we can do as supplement. To be able to take care of your mind as well, recharge the batteries. We have some of that stuff there around what happens if the allosteric load goes down, or this water in the bucket goes down. Maybe we're happier, of course, more motivated, more productive. We have better focus and concentration. Going back to that polyvagal about being in the green zone, being able to be mindful and present in the moment, then usually then linked to if someone's able to then focus and concentrate better, of course, for their job, but also if they're doing whatever they're trying to focus on, the task. And their stress tolerance will also potentially improve and increase, which is a big one. People actually are resilient. People are able to be resilient if they have that background and backbone, or that health as that foundation. Strength training is one of those key things that help improve someone's stress tolerance, because they're putting a stress onto their body, having more muscle as well, and being fitter, all really important things. Also, people can keep pulling their foot on the gas or keeping their foot on the accelerator until eventually they might need a holiday to escape. But some people, I ask that question for stress relief or cope mechanism. Is that a healthy way to go about things? Potentially living to work and then weighing into a holiday then to feel alive and feel, oh, this is the life. Or potentially could be the opposite, where working to live is a different way about approaching it, and to think about a different way of thinking about how someone works and does holidays and lives their lifestyle. All these healthy measures also have hugely important for this high road idea, which I do with clients and would have conversations over a whiteboard with. Only people who make those conversations know and understand what that is, but a really important thing. So how to avoid the cycle? We have all these things to consider and to go into when we think about the idea with the stress cycle, for example. And when we get into a cycle, it's very hard then to escape and break that cycle. And all the things that will then contribute and be going on with our body and our health. Of course, from our joint stiffness, feeling muscles feeling weak all the time if we're under a constant state of stress. Obviously some issues, obviously body composition wise and energy wise. Potentially obviously stuff going on of some people feeling like they're feeling like inflammation all the time, or potentially issues in their cardiovascular system, potentially issues with how their bodies feel as well from that trigger point, or muscles just feel so tight and tense they have to always end up getting some support in a massage or chiropractor or something like that. Obviously decreases in how their muscles would form and all the stuff that will go on as a result of what they're trying to do for their job, but then also if they're playing sport. Some people get caught in this vicious cycle and they get stuck here for years and years and years and years and years, and it ends up having a burden on them and having that toll, and it will definitely be taxing, that's for sure. So in order to break that stress cycle, one of those important things, if we go back to our green zone and go back to our rest and digest mode, it's actually to stop, breathe, and get centered. Simply just get in touch with how we're breathing, how we're able to control our breathing, which is the most vital aspect of being alive and being healthy. And also, I always encourage people to try that some nose breathing if they're able, to actually be able to get into this idea about reducing a lot of the mouth breathing, trying to get into this nasal breathing, and seeing all the compounding health effects from this potentially low-hanging fruit habit that can then have a real difference and a domino effect, and able to maybe affect their ability to tolerate stress as well. Potentially reflect and have a reality check, or put things in perspective, because we realize that we have a lot of stress going on, a lot of things causing us stress. But perspective is one thing, because we know that there's some people out there in this day and age around the world in this life who have things 10 times as stressful as what we have, 100 times as stressful as we have. Potentially they're in war zones, potentially they're in areas of conflict, potentially in areas of if they don't know if they'll be able to have food for the next few days in a situation. Obviously all these are in the Middle East at the moment as I speak, and for the past couple of years with this area of conflict and unrest, but other areas of the world also experience hardship and adversity, setbacks, circumstances, which is so difficult, that we realize that our problems, that whatever's got going on, for we're watching, wherever we're watching, whatever stuff we've got going on as we're watching this, sometimes the perspective is often there, because it does give us that reality check of like, oh, maybe I'm actually not as bad, or I'm pretty well off. And there's the quote that someone's worst day in their life and somewhere halfway around the world is someone's best day of their life if they lived in your shoes, or whatever that quote is, if someone's shoes are on the opposite foot, or shoes are in someone else living in your shoes, they're the best day of their life compared to if it feels like it's your worst day of your life. So those are really important things to consider and really important aspects, because we know we have a lot of stuff going on sometimes. A lot of people have a lot of stressful, busy lifestyles, but also they have a lot of things they also probably grateful for, even if they don't be aware of it or they don't think about it at that time. So again, this ability then to choose, being able to adapt or have stress management techniques, or be able to have coping styles, how they cope with stress, how they manage stress, what techniques they use to manage stress. And again, those things which we can choose and have control over as well. Really, really important areas of being able to realize and break that negative cycle of coming from news, for example, at the moment, if it's that perspective and reality check, but breaking that negative stress cycle, being able to choose and have the ability to how we use those techniques. A few little cheeky, cool memes here. You always got a bit of fun to finish off. And yeah, as I say there, the old lavender reduces stress. So someone literally bathes himself in it almost and covers himself in it. And then the old work one where the Simpsons, someone's got a new employee, and so that's where they go to cry area. And then someone, obviously, if they got a bit of stress, you can definitely see and you can ask them. Being able to potentially shift a little bit away from that and realize that, we have some ability to have some fun and think about stress again in that fun, not serious way. So you do stress spelled backwards is also desserts. And sometimes we don't have to work all the time. Work is obviously one thing we do, but we don't have to do it all the time, of course. Well, it depends on how we do it, of course, but sometimes you need to not just think about what's causing you stress, and you got a bit of peace and inner peace, as the top one has there. But no matter how small a step, forward is forward, and someone is able to deal with whatever's got going on and the stress they got going on. So hopefully you gained a little bit about that idea and that understanding of stress, and picked up some things and are able to take that moving forward. And as it says up there, you've got this if you are under a bit of stress or got some things going on, as we discussed in the presentation. But stress is also life. So whether we like it or not, we're going to have it. It's always what then we do with it, and how we manage it, and how we cope with it, and how we respond and have awareness around it. It's going to be the lasting difference. Hopefully you got something out of this as well.